Hello, everyone. As you join us today, um, I will go ahead and get us started. So we are respecting everyone's time and presentations today. Oh my goodness, you guys use so many AI note takers. It's incredible. Okay, so welcome to today's Health Council talk. We are joined today by the Fostering Family Kinship Program. So we're joined today by Michael Martinez, who is the grant manager, and Itzel Barrera, who is the licensed master level social worker and program manager. Let me begin with our land acknowledgements. The New Mexico Alliance of Health Councils gives sincere gratitude for the opportunity to live and work here on ancestral and unceded lands that have been cared for by our state's original peoples of the Apache Nations, Pueblos, and Navajo Nation. We honor and respect the indigenous cultures, traditions, languages, and the rich contributions that continue to shape New Mexico. Together, we acknowledge the history and impact of genocide, dispossession, colonization, and ongoing systemic inequities on Indigenous communities. As a collective, we commit ourselves to working towards justice and reconciliation, dismantling inequitable systems, standing in solidarity with and respecting relationships with Indigenous peoples. The Alliance affirms Indigenous sovereignty, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations. In offering this land acknowledgement, we encourage you all to reflect on your own relationships to the traditional lands and take concrete steps to dismantle systems of oppression where Indigenous peoples are empowered and celebrated. All right, let me see if Val is here so she can welcome Joseph.
I am right here, Sam. Happy Friday, everyone. It's so great to be here with all of you. I wanted just to first take a moment and invite you all to join us, join the Alliance team in giving Joseph Hill a warm welcome as he joins the New Mexico Alliance of Health Councils as the Health Council and Public Health Specialist. Welcome, Joseph, if you can wave so folks can see you. So great to have you. He, of course, has been serving as a board director at the Alliance, and now within this new role, we're so excited for his leadership and his heart that he brings to everything that he's engaged with and all the ways that he serves communities across the state. And of course, together, we're very much looking forward to the meaningful progress that we get to make alongside county and tribal health councils. And of course, you'll learn more about his work as we connect with health councils individually and with our public health partners about the work that we will be, collaborating on together. And here you have a bio, but just very quickly to highlight Joseph's background in managing Hidalgo County Health Council back in the day, working along with public health systems, successfully sourcing grants and managing these grants with meaningful impact across communities. And of course, his work in cross-sector collaboration makes Joseph a very powerful addition to the team. And we're so excited to continue to serve county and tribal health councils, leveraging you all for success in service of communities statewide. Joseph, so happy to have you with us. Happy to hear from you if you have anything to share with all of us.
Sure, absolutely. Just very glad to be on board. I've met many of you over the years. Some of you I've yet to meet, and I'm looking forward to building relationship with. I'm very excited to be a part of the position. I'm very excited to support everybody in any way that I can. Please don't hesitate to reach out to me.
Beautiful, Joseph. And just to let county and tribal health councils know that Joseph, myself, Geraldine will be connecting with you all individually to go over your needs and what is your priorities and your needs going into this new fiscal year with your new contract, but with the, with the full body of work that you're leading across communities. And of course, go over our membership agreement that we launched yesterday, in ways that we can continue to support you for success. And we see Margaret and others chatting, welcoming you, Joseph, in the chat. So thank you all. And Sam, if we can move forward to the, okay, go for it. Oh, we're the other way, the other left. Just some highlighting some timely updates. As you know, we've launched a comprehensive survey. This survey helps the Alliance team in curating our advocacy, policy briefings as we engage and enlist the support of the executive branch of legislators during the interim session, which is happening right now, so that we can petition them to support in reinstating recurring funding for health councils. So a lot of the information that you're sharing with us in this survey informs our advocacy collateral. Moreover, the information you share informs the professional development and training services that we curate in support of all of you, all the technical assistance needs. This year, we've also issued a tailored technical assistance service to support you with Section 3, with your behavioral health initiative. So the comprehensive survey is so key. Thank you all who have been able to submit that. We understand it takes a little bit of time to complete the survey. So, we've incentivized the effort, $50 Amazon gift card for you as a thank you for taking the time to complete that survey. The other timely update is the Community Collaborative Forum, which is coming up August 20th. We're bringing partners like NMDOH, and now the administrations of the court, of course, to talk about SB 3, the Senate Bill Behavioral Health Reform and Investment Act, and what the progress updates are around that legislation and how we are aligning our efforts with the current scope of work in behavioral health initiatives to support our communities with those priorities. Yes, Michael Martinez, Sam will plug in the link to the survey in the chat. Thank you so much for that request. And during the Community Collaborative Forum, we'll have DOH also presenting, and we're going to be highlighting the work of health councils, early childhood education coalitions, behavioral health collaboratives, LCs, to showcase how these community coalitions are collaborating in service of communities across our state. A little update on the statewide meeting in Public Health Day coming up for 2026. We're going to be launching planning committees in September. So be on the lookout for an invitation to all health councils who participate in curating these two very, very important convenings coming up next year. And last but not least, you may have seen in your inbox yesterday and the day before the SFY 2026 Alliance Membership Agreement. As I mentioned, Joseph, myself, Geraldine will be meeting with you individually to go over the agreement, answer any questions you may have. But these agreements essentially continues to strengthen our partnership in and around advocacy efforts and in the core services that we get to provide in leveraging health councils, core functions and body of work that they're leading. Geraldine, Sam, Joseph, anything else along that piece? If we're feeling, and of course, we continue with our year-round advocacy efforts. So any testimonials from community members, partners who work closely with health councils, any testimonials that highlights and contextualizes the meaningful and impactful work of health councils, send it our way. We utilize this information as part of our visibility campaigning for health councils, as part of our advocacy calls to action campaigns, as we engage with legislators to learn more about the work that you're leading and enlist their support in ensuring there's recurring funding for health councils moving forward. Great to see you, Diana Good, as well. All right. Any questions, reflections about some of these highlights? I know I'm trying to pack up as much in such a short time because we have our trainer here as well. And we'll put our emails in the chat. So if anything comes up later, we're happy to, connect with you.
I'll just add that even if it's as simple as like we hosted an event and here's a photo, would love it. That would be incredible to share as well. And then just a few reminders, the QPR training is coming up in the next couple weeks. The registration closes today, and I'll be sending out the final links for whichever signups dates you would like. So you just choose one date. It's an 1.5-hour virtual training. You'll be completely certified. So just follow this link. I'll put it in the chat in just a second, and you'll be all signed up and ready to go. We have our advocacy links here. Val, would you like to add anything?
No, you go for it, Sam.
Okay. So on our advocacy page on the website and right here, which we'll send out on Monday, you'll be able to find how to and where to contact your district legislators, upcoming meetings for the Legislative Finance Committee, including their contacts and their aides contacts. Send them email, sign the letter of support, share that out with your community. Again, I'll throw the links in there in just 1 second. And now I will officially welcome our 2 presenters again from Fostering Family. So welcome, and I will turn it over to you.
All right, well, I'll go ahead and get us started. Thank you all for inviting us to come present today. I know a lot of you, it's nice to see so many friendly faces. Hello, Val, Geraldine, Sam, Diana Good, my good friend Diana Good. I'm gonna go ahead and share my screen now. All right, do you all see my presentation? All right. Let me make my window bigger here. And if you all have any questions, please feel free to enter it in the chat. I'll try to keep an eye on that as Itzel and I are presenting, and we'll go more into introductions of ourselves here in a moment. Again, we're with Southwest Family Guidance Center. We're here on behalf of our Fostering Family program today. We are partnered up with CYFD on this grant, as well as some of our other grant partners that we will introduce here further into the presentation. I've been with Southwest Family Guidance Center now for, hard to believe, 11 years. I started with the Healthy Transitions Grant in Valencia County all those years ago, where we were working with young people 16 to 26 as they were transitioning into adulthood and helping to support them, filling in those gaps, those service gaps, and providing life skills coaching and helping get access to resources and services. I was also a community support worker for several years, as well as I've been working with our Fostering Family program since the beginning about 5 years ago. And I'm now proud to be the grant manager of the Fostering Family program, and I will let Itzel introduce herself now.
Hello, everyone. Thank you for having us. So my name is Itzel Barrera, and I'm a licensed clinical social worker. I've been working for Southwest Family Guidance Center for 9 years, and happy to be here and definitely doing the work that we do. I kind of do a little bit of everything. I started with providing individual therapy, family therapy to a lot of families. And then they invited me to be a part of Fostering Family, and I was happy to do so because I previously was working for CYFD and was working under the placement unit, working with foster parents and a lot of grandparents, kinship guardians. And so this really is an area that I'm like really passionate about, and I love working with this population. So I was just really happy to be a part of this program as well. But I also, I'm the supervisor for the Comprehensive Community Support Services program here at Southwest. And so I'm a person of many hats, and I'm always open to provide any additional supports that I need for any community member, anyone that I can help and support. So just thank you again for having us.
All right, thank you, Itzel. All right, just to introduce some members of our administrative team who aren't with us today. Kevin Pierce is our CEO. Dr. Craig Pierce, he's our founder and our chief clinical officer. Stacy Scanlon is our clinical director. And Robin Troncoso, she is our grant consultant. Starting to go into a little bit of data now. On a national level, for every one child in foster care with relatives, there are 19 children being raised by grandparents or other relatives outside of the foster care system. And that's from Generations United in 2020. At a state level here in New Mexico, the prevalence is much higher. By some census estimates, as many as 55 children are being informally raised by kin for every one child we know is being raised by kin through the state's foster care system. It's just a mind-boggling number, and that's from the Lanel Foundation from their Resilient Families report last year. In New Mexico, 10.9 or about 1 in every 10 grandparents are raising their grandchildren. That's from the Con Alma Health Foundation. Many more children are being raised by grandparents and kin in New Mexico today than in 2017. It's about 20% higher. So from 2017 to 2023, the number of children in kinship care rose from 30,000 to 36,000, an increase of 20%. And from the studies and data we're seeing, it's continuing to rise. Between 2021 and 2023, New Mexico had the highest percentage of children in kinship care, 8% of any state, and more than double the national average of 3%. This lack of parental involvement in New Mexican families is associated with substance abuse, incarceration, divorce, mental health diagnoses, domestic violence. And I also want to mention that it's the reasons for kinship care isn't always a negative reason. It can be due to military deployment, immigration issues, and also COVID-related illnesses, death or unemployment. All right, I'm going to hand it off to Itzel now.
So some of the challenges of kinship care that we've identified, in working with families directly, especially, well, and we're going to talk a little bit about like the challenges that caregivers experience, but also the challenges that the minors experience. So some of the challenges for the caregivers is a financial strain. Grandparents raising grandchildren on fixed incomes, don't receive stipends, and sometimes don't receive government assistance. Assessing income support services can be challenging. So one of the things that we've seen with a lot of our caregivers is that they are retired and they have to go back to work, and because they can't financially meet the needs of the family anymore because there's other children now in their home, and they have to return back to work in order to ensure that everyone has what they need. But they also like struggle because a lot of them don't have permanent kinship guardianship and therefore don't qualify for government assistance. And so that's definitely something that they come across as a challenge, and they just constantly have to navigate the different systems to try and see and obtain what they need for their families. Some legal hurdles, navigating court system alone, language access issues, notifying parents when whereabouts are unknown. As we all know, like the legal system can be really challenging. And for these grandparents and kin caregivers that are kind of overwhelmed by everything that's going on, that's just one more layer of just challenges that they have to face on a daily. And so we definitely want to continue providing them support in that area. And we'll talk about it a little bit more in our presentation. Emotional adjustments, prioritizing grandchildren above their own children. They're really kind of stuck in between. Like, a lot of the times it's like their children or family members that they want to provide support to, but also on the other end, they're prioritizing the children that they have in their home and what's going on with them and trying to meet their needs. So they're kind of sandwiched in between, and trying to navigate that can be really challenging for them. Older siblings raising younger siblings, that's another thing that we see a lot happening. And so they're trying to navigate their lives and trying to figure out, and all of a sudden they become parents to their younger siblings. And so that's always very challenging as well. Parents going through substance abuse and addiction issues is a very common one as well here in the state of New Mexico. And then navigating children's needs, enrolling children in school, finding childcare, establishing children with doctor's office appointments, mental health providers. Like I said, when you have a child in your home, it requires a lot of time and attention. And for a lot of these grandparents and caregivers, they haven't had to do that in a very long time. So having to navigate that again can definitely be extremely challenging for many of them. And then as far as the minors, some legal hurdles, lack of birth certificates and social security cards, a lot of them don't have their documents and don't have the ability to automatically access those documents because the caregivers don't have permanent kinship guardianship and cannot obtain some of those documents without one. And so that's one of the areas that we also see very common. Emotional adjustment, children having a guardian for the first time in parents' absence. So a lot of the times they haven't had that parental figure in their life, and now having to come back and be like, okay, you have to follow rules and you have to do certain things a certain way can definitely be really challenging for them as well. And that's where we see a lot of behavioral issues. Strained or non-existent relationship with the parents. A lot of the times the parents are homeless and just are not around at all. And so they don't get to interact with them a whole lot and get on at all sometimes. And so it can definitely be a very sad situation. Therapy to process family trauma could also be challenging for some because, it's just hard to even get into mental health services at this moment just because there's wait lists everywhere and there's a lot happening. And so it can also be a challenge for many families. Education hurdles have been moved around to multiple schools or not enrolled in schools, need guardians to establish IEP. So just a lot of educational neglect that has happened too, where a lot of them are falling behind and have fallen behind and trying to catch them up. So that's also something that we see a lot. Outcomes of abuse, abandonment, and neglect, developmental delays, malnourishment, untreated medical needs. So as you can see, there's like a whole list of challenges that both the caregivers and the minors face. Next. So some advantages of kinship guardianship is that it minimizes the trauma for the children. It improves children's well-being. It increases permanency for children, improves behavioral and mental health outcomes. It promotes sibling ties. It provides a bridge for older youth, and it preserves children's cultural identity and community connections, which is very important. Next. Kinship Navigator program started over 20 years ago as state and county initiatives. These programs assist kinship guardians in navigating the many systems that impact them, including child welfare, aging, education, housing, and healthcare. Next. So as Michael had mentioned previously, we are partnered with the Children, Youth, and Families Department, who oversees the Kinship Navigator program. They provide grant support and they assist with outreach and marketing. And then obviously our agency, Southwest Family Guidance Center, we provide the fostering family program, but we also provide other services. We provide office, school, and community-based services to continue providing those additional supports that a lot of our families need. Next. We are also partnered with some legal partners, New Mexico Legal Aid and Pegasus Legal Services for Children, which we refer a lot of our families to obtain the kinship guardianship, the permanent kinship guardianship that they need, or a lot of them are interested in adoption. And so they are also providing supports to the families that are wanting to seek that. Assistance in completing kinship guardianship packet, because they're pretty extensive. They have a lot of information. Like I said, it's the legal language can be very challenging to navigate. So they definitely provide them supports in that area, as well as full legal representation. And they also provide legal clinics and trainings. And we're also partnered with Share New Mexico and New Mexico Alliance of Health Councils. And so I'm sure you're all aware of the sharenewmexico.org website, where we provide, they provide the resource database, and we're able to really identify if a family needs housing, transportation, whatever it is that they need, we can really go into the Share New Mexico website and obtain those resources very easily. which is very nice. And then Michael has been a huge part of the New Mexico Alliance of Health Council initiatives and has been really bringing that to my attention and to the attention of our team, and really encouraging the community support workers to attend the meetings, the community meetings, and just being a part of it, because we know that that's also a big part and very important. So we are happy to be here with all of you. Next. So what is fostering family? So as mentioned earlier, we're partnered with CYFD as a relative success center. I always like to call us like a resource hub, and like, kind of like the operators. When you used to call an operator, they would connect you to who you needed to be connected to. And that's kind of what we do. We definitely, when we're working with families, we connect them to the resources that they need, specifically what they're asking us. That's exactly what we do. We're constantly doing research and identifying what's available in each family's community, so that way we can connect them to exactly what they need, and we keep all the resources very updated, so that way we're not sending them and they're like, oh, never mind, we don't have that for you. Like, we definitely want to make sure that they're receiving the most appropriate, accurate information from us. We provide and facilitate services for caregivers and the children in their care. We help navigate other systems such as legal, financial, school, and many other things. It really just depends on each family and what their situation is, and we kind of tailor to that. Next. So what are some things that families can expect? We complete an assessment of the family's needs and services they may be eligible to receive. Referrals for assistance in completing guardianship packets, school registration, and medical services, just to name a few. We do monthly check-ins with the Kinship Navigator. We provide information and resource referrals for local, state, and national services. And then we provide education related to kinship care and peer support groups, which we'll be talking to you guys a little bit more about it later. Next. So the process. The client completes a request for services, or any other someone that might be working with the family can also submit a referral for the family. That's totally okay. They would just go to our website and they can submit for or request for services for themselves, or like I said, any other provider can also request for services for a family. And then we complete an assessment of needs is performed, and we kind of, what happens is once we receive the referral, we have 48 hours to contact, or within 48 hours, we will contact the family and we will schedule a time to make or complete the assessment of needs for the families. And then a kinship navigator is assigned to them, and that's when everything kind of begins. Referrals are made for professional services. Like I said, we do ongoing check-ins and services, and Spanish-speaking clients are welcome, because about 80% of our community support workers are Spanish speakers. So we can definitely provide that. And this is a service that we provide statewide. So any place in New Mexico, we are able to provide services to. All foster family services provided are without charge, so we don't charge anything for the services that we're providing. Next. Who qualifies for services? So any relative, godparent, member of a child's tribe or clan, or an adult with a significant bond known as fictive kin, who are raising the youth because the biological parents are unable or unwilling to do so. And as we mentioned, permanent legal guardianship does not have to be established in order for us to be able to provide services for them to qualify for our program. Next. For this grant, legal immigration status does not have to be established. Southwest Family Guidance Center does not ask any questions about legal status. For referrals made to external organizations or resources, we cannot guarantee that they will not be asking any questions about legal status, but as far as our organization, we do not ask for that. Next. Michael, I will hand it over.
All right, I'll go ahead and take over again. I wanted to speak a little bit about how to make a referral to our program. There's several different ways. We have a website. It's www.fosteringfamily.com. I went ahead and I put the link to our website in the chat. You're welcome to pull it up while we're finishing up our presentation, and take a look around, see what we have to offer. You can also call our office at 575-524-6820. We accept referrals from professional partners in the community like you all. Clients can directly submit a referral as well. And we will staff all those referrals. We'll have somebody reach out to them within 2 days. Thank you, Val, for joining us. Have a good one. And families will be designated to or assigned to a designated person within 2 days. I also wanted to mention that we do not have a wait list for this program at all. We can start working with a family as soon as 2 days to a week. So especially those families that are needing that support right away. And I already spoke about our website a little bit. I'm going to show you a little bit about what our website has to offer. We have a list of different resources available to our families. These are statewide and national resources for financial assistance, educational supports, caregiver resources, just to name a few. We also have our kinship training series that meets once a month, the second Wednesday of each month during the lunch hour. Many of those trainings we record and we upload to our website so a family can go at any time to view Dr. Pierce's presentation on trauma-informed care or a presentation about online schooling, legal issues, a legal Q&A. And like I mentioned, we do have ongoing trainings, so we're always adding to this as well, and families are welcome to join us live for those presentations and also view them at their own convenience. We also have a page with our legal resources, with our legal partners, links to those trainings and how to download the legal guide as well. I wanted to speak a little bit. We just wrapped up our last fiscal year, FY25, and I wanted to speak a little towards the data for you to you all today. This last year, we worked with 2,839 families, 4,827 children in those kinship caregivers' care. Our community support workers, our kinship navigators, provided 2,836 monthly check-ins during that year, and we made 5,575 referrals for basic needs or legal services, training, CCSS, or other mental health services as well. Southwest Family Guidance Center also provides a range of other services and supports as well. We have office-based therapy, both individual and family. We have school-based services, multi-systemic therapy in several counties throughout the state. We have our comprehensive community support services, our CCSS program that we can also provide throughout the state to any family in New Mexico. We have our Thriving Kids parenting program, as well as our 7 Challenges substance use program in our Las Cruces office as well. We do have some upcoming events. Our peer support group is launching up again with the start of the school year. It's starting up next. It's always the first Thursday of the month at 12 p.m. during the lunch hour. Our next group is August 7th, so next week at 12 p.m. We invite any kinship caregiver to join us for these virtual peer support groups. We're also going to be starting in-person peer support groups this year. This is going to be a first for us, but our families are requesting that. They want to connect with other kinship caregivers, and that can be oftentimes challenging virtually. So we're going to be having in-person peer support groups in the northern, central, and southern regions of the state biannually. We also have our virtual training series for kinship guardians. That's the second Wednesday of the month at noon. Our next training is going to be August 13th. Dr. Pierce is going to kick us off with his trauma-informed care training. And again, any kinship caregiver can participate. To register, they just need to reach out to me by giving me a call, and I put my number in the chat there as well as my email. All right, and that's actually it was for our training today. Let me see. Stop share. Does anybody have any questions for us today? No questions? That means we answered everything. I like that.
Means you did a great job. Way to go.
Right.
So of course I'll share this presentation with everybody, but do you have any other like flyers that are geared towards certain things that I could share or get out there as well?
Yeah, so with the new fiscal year, we're working on updating our graphics and our flyers. We like to include all the dates for our kinship training series and our peer support groups. So we actually just finalized that last week. So as soon as I get those updated, I'll share that with you, Sam, and you're welcome to share it with the group.
Perfect. And I know that you mentioned, I guess I do have a question, how there are certain things you do or don't require for folks coming in. Do you see any impact from funding situations impacting your program at all?
Not with our program specifically. We were awarded the same amount as we were last year. So we're able to still deliver the services at the same capacity that we have been. We've been very fortunate with in that. I know other organizations and agencies haven't been so fortunate. But we're looking to collaborate with the community, with community partners, and help to fill in any gaps that we can, as well as collaborate. So yeah, for at least another year, we're able to continue providing these services. We're also partnering up with other agencies and organizations that deliver services to kinship care, like Las Cumbres and Family Strengths Network in the North. And you all may have heard that House Bill 252 passed. That's the kinship pilot program that the Aging and Long-Term Services is going to be heading. So they're still working on the rulemaking for that program. They're going to be delivering services and supports in 5 to 7 counties throughout the state, as well as stipends for families in those counties as well. We actually had a visit from the federal government accountability office earlier this year, and they noted how New Mexico does such a great job at working together, at collaborating, and they haven't seen that in other states. So not just for our program, but really for all of our agencies and organizations here in New Mexico. And that's all thanks to you all for just showing up each day for the families that we support. And yeah, I just wanted to thank you all for that.
That's all really great news. And I mean, I agree. I think New Mexico tends to work really well together and are very welcoming and open. So I appreciate hearing that from a collective outside group as well. Okay, great. Well, thank you so much for joining us. If no one else has any questions or there's nothing else you want to add, and if something does come across, I can always send you both an email as well.
All right. Thank you, Sam.
Thank
you for
you.
hosting us.
Thank you so much. Have
Thank
a
you.
great weekend.
Bye-bye.
Bye.